Welcome to Mercy Medical Center's live webinar. Today we'll be discussing what first-time parents need to know. Joining us is Dr. Roger Allen, neonatologist at Mercy Birthplace. After his discussion, he will take questions from our audience. To submit your questions anytime during the discussion, go to the window in the upper right-hand corner of your screen and type in your question. If you don't see the screen, click on the orange box with the white arrow. Your questions will be confidential. Welcome to our webinar, Dr. Allen. I'm going to hand the mic over to you now, and we'll go ahead and get started.
Good afternoon. Well, when you first see that baby, he or she doesn't look like much. They're often covered with vernix, which is a cheesy type material, and some blood. Their hair is a mess. Their face is puffy. They seem to sleep more than anything else, and sometimes they're not really quite what you expected. As you look them over, you'll find that they have some soft spots on their skull. There's two of them, one in the front and one in the back, and those are normal. They're to make room for the brain to grow. They'll have some rashes over the first few days. As you look around, they will often have some birthmarks. There are often some reddish patches over the eyelids and the nose and the back of the neck, and those are all normal too and will fade over the first year. As the first few days go by, you'll notice that they'll get a yellowish color, which is jaundice. All babies get jaundiced. They are most jaundiced usually at day 3 to day 5. And that's because we all make bilirubin, and it's eliminated in the urine and bowel movements. So the more you feed them, the more quickly the bilirubin gets eliminated. When it gets high enough to be of concern, we can use some special lights to apply what's called phototherapy to help bring the bilirubin down until the baby's liver can start working properly to get rid of it. Now, during the hospital stay, there's a few things that we're going to want to do. There are some shots involved. One of the things that we like to start is immunizations for hepatitis. And while you don't worry about your baby getting hepatitis at this age, as they get older and they're exposed to blood products and so forth, that becomes a risk for many children. So the recommendation of the experts is to go ahead and get that started in the nursery and finish that up as part of all baby visits. The other thing that we like to do is to make sure the family is protected against whooping cough. The shots that we give babies for whooping cough really don't provide them with any direct benefit until 4 months of age. And so we want to check with the parents and make sure that they're properly immunized so that they can't pass it on to the baby. Some babies are susceptible to bleeding problems that can be prevented by vitamin K, so we like to give a vitamin K shot as well. Also, we'll be drawing some blood to check for certain diseases. There's a screening test we send off to the state that checks for low thyroid and other things. It's a series of diseases which can be devastating to the child, even though they're rare, but can be, in most cases, easily treated. And so it makes sense to check this on every child to pick up those few that have special medical needs. We also screen for hearing problems and heart problems because children do best when those are picked up before they develop symptoms. Now, if you have a boy, one of the questions that will come up is, should we circumcise our baby? There's no perfect answer to this. There's no compelling reason to do a circumcision. There's no compelling reason not to do a circumcision. The experts think that circumcision will reduce the risk of urinary tract infection, reduce the risk of cancer as an adult, and reduce the risk of AIDS as an adult. The cons, of course, include the pain of of a surgical procedure, even though we do use some lidocaine to help reduce that. There's the cost that's involved if your medical insurance doesn't cover it. And of course, there's the risk of the usual complications of any surgery, even though those risks are very, very small. The procedure in most cases involves putting a cutting guide in place. Some of us use a plastic cutting guide and some a stainless steel cutting guide, but we put a cutting guide in place so that we remove just enough skin but not too much. And then afterwards the children are observed for a short period of time in the nursery, and then are returned to your care. Depending on whether we use a stainless steel cutting guide or a plastic cutting guide, there may be a plastic ring in place that comes off in 5 to 7 days. In the case of the stainless steel cutting guide, there is no plastic ring, but you'll want to be careful with cleaning so you don't separate the skin edges, and put a little bit of ointment on there to keep the area from sticking to the diaper. In either case, in about 5 to 7 days, the skin and the circumcision are healing well, and after that they don't require any special attention. As far as bathing goes, it's important not to overbathe that baby. Babies don't produce a lot of skin oil, and it's easy to wash that skin oil away, and that will promote rashes and other problems. Babies, of course, poop and pee on themselves on a regular basis, and it's important to clean all of that away. But as far as a whole body bath, 2 or 3 times a week is sufficient. And when you do, use just a little bit of soap. It's more the water and the washcloth that do all the work for you. And remember that part of the bath is to have fun with that baby. Safety is important. You want to bathe the child in an area where they can't slip into the water, so only a few inches of water, and you should use either a tub made for the purpose or a sink like the kitchen sink that's at waist height with a mat or a cloth in the bottom, so that it's easy to get a good grip on the baby. Put your arm around the back of the baby and grab the arm on the other side. That allows you to support the head and also keep good control of that baby so they don't slip out of your grasp. Before you put the baby in, of course, make sure the temperature is just right. The water should be no warmer and no cooler than your hand is comfortable in. As far as lotioning the baby up, you can do that. It makes them smell good, but that lotion isn't necessary. Umbilical cord. For about the first 7 to 14 days, the umbilical stump will be in place, and it usually takes care of itself nicely. And all you really need to do is keep the cord clean and dry so that it can protect that area against infection. That means not soaking it in the bath, making sure that the diaper is off of the umbilical cord stump. If the cord starts getting soft and gummy and smelly, as it sometimes does, a little bit of rubbing alcohol and a Q-tip can be painted on the umbilical stump, and as the alcohol dries, it will pull the water out of that stump and make it hard and dry again until it finally comes off on its own. Nail care. First of all, I'll assure you that if you're trimming the baby's nails, eventually you're going to cut into the quick and get a small drop of blood, and you're going to feel bad, and that happens to everybody. The best way to cut the nails is to have somebody help you so that they can hold the hand and you have both of your hands available to trim those nails. And when you do trim them straight across. and leave just a little bit so that you don't cut into the quick. Skin care. Babies just seem to get a lot of rashes and other issues. That's normal for that skin that's still in development. The first rash that you'll notice in the first few days is something called erythema toxicum. That's a long name for a common rash. The children will get covered with red dots with a kind of a yellowish ring around them, and these tend to come and go, and they're most prominent in areas where the baby's skin is kept warm, either by laying on the mattress or under the diaper. This is a harmless rash. Probably the best explanation for it is that skin is being exposed to air for the first time, and this is, in a way, an allergic reaction to that first exposure to air. And once it gets used to the air, the rash will fade away and disappear for good. But the key is that every time you check it, it looks different, and almost nothing behaves like that except erythema toxicum, and if that's what it is, you don't need to worry about it. Eczema and contact dermatitis. That skin is sensitive, and babies will often get a drool rash wherever the saliva touches the skin. It will tend to break out and get flaky. Do the best you can to keep that saliva off of the skin. It's not always possible, I know, but help keep that skin clean and cool and dry, and that will help keep that rash under control. Eczema is often seen in the kids as they get a little bit older. That also is a sensitivity rash. It tends to be most prominent in the folds of the elbows and the knees, and this is something where you do want to use lotion. Get something inexpensive that you can use a lot of, like Vaseline, and the treatment for most contact dermatitis is oceans of lotion. Just keep them lubed up, and that will keep that under control. Thrush. Many children during their first month will tend to get an overgrowth of yeast in the mouth. We all have yeast in our mouth. It's part of the human condition, and it's only a problem when it starts to pile up and make what looks like cottage cheese in the mouth. If you see kind of a lumpy white discharge inside the cheeks, run your finger across it. If it wipes away, it's simply milk curds. But if it stays put, if you can't brush it away, that's thrush. And while it makes the babies a little bit uncomfortable, it's usually not dangerous. There are some medications that your physician can prescribe that will help with that. When you treat the baby, it's important, if you're breastfeeding, to talk to the doctor about treating the breasts as well, because that will reinfect the baby if you don't treat both the mother and the baby at the same time. And if the baby likes pacifiers, or there's something else he likes to gum on, put that in some half-strength vinegar water and let it soak, and the vinegar will kill the yeasties off of the pacifier so that it's not likely to reinfect the baby when the treatment is done. Now, as far as sun protection, sunscreens like you and I would use really aren't very suitable for infants. So you need to protect them from direct sunshine. When they're in their car seat, just a thin blanket thrown over the car seat, something that air will pass through easily, will cut down on the sun and keep them from getting sunburned. When they're out from under that blanket, a broad-brimmed hat or bonnet to keep the sun off of their face, and a long-sleeved light cotton shirt and pants will help protect them from the sun, because they do not tolerate sunburn very well at all. Clothing your baby. One of the best things you can do is to ask relatives if they have any hand-me-downs, because babies are messy things, and you'll go through a lot of laundry, and having a big pile of old formula-stained clothing that you can put on when you're at home is a handy thing to have. That's also usually well-washed, and that nice, soft, well-washed cotton is very comfortable on the baby's skin. When you're looking at new clothing, You'll want something with loose sleeves that's stretchy so you can get those rubbery little arms through the sleeves without struggling too much. Make sure this fabric is soft to the touch. I prefer that they not have those sewn-on medallions. They're nice decorations, but they tend to hold the heat against the skin and make the babies kind of rashy. Make sure that things are flame resistant. And make sure that things are easy to get on and off. There's lots of outfits out there that have lots of snaps and buttons on them, and they look lovely, but getting those all lined up is tough. So something loose that you can just toss on that baby is convenient. As far as washing the clothing, a lot of water and not a lot of soap. We want to avoid soap residue in the clothing because it will make the babies rashy. It will take that skin oil out of their skin. And it really isn't necessary to use a lot of soap. Sometimes some washing machines you'll need to double rinse the clothing to get that last of the residue of the soap out. And avoid fragrances in the soap if you can. How warm should I dress the baby? Well, the temptation is always to overdress them, even in the winter months. The truth is babies only need one more layer of clothing than you're comfortable in. And what's the easiest way to check if they're the right temperature? Well, reach out and grab the baby's hand. If the baby's hand is warmer than your hand, they need a layer less. If it's cooler than your hand, they need a layer more. But you'll generally find that that your initial guess is plenty of clothing for that baby. Sleep. Now, initially those babies don't give you any sleep at all. They get plenty. They'll sleep for about 12 to 18 hours a day at the start, and they'll only sleep for a couple of hours at a time. So it seems like you're either feeding the baby or they're taking a nap and getting ready to eat again, and you're trying to get by with sleep 2 hours at a time yourself, in addition, and not only feeding but doing all the other things that child needs. And it can be pretty exhausting. The good news is that by 6 months of age, while their sleep is down to about 9 to 12 months, about half of them will be sleeping a good stretch, 6 hours or so during the night. And so about half the kids are doing a reasonable job of sleeping through the night by 6 months of age. How do you promote good sleep habits in the child? Well, babies are going to take their cues from you. As far as the period of time when you want your baby to be awake, have them out with you. Have them where the action is. Have a car seat or a basket or a playpen, someplace where they can be, where it's out and noisy and they can hear people talking and doing the things that happen. And they'll learn from that that's the time of day to be up and about and see what's going on. As far as sleeping time goes, the room should have the same noise level and appearance and light level as nearly as possible, the same every time you lay the baby down, so that they know that when the room looks like that and sounds like that, that's the time to sleep. And for that reason, you should lay them down drowsy but awake, so that they'll associate that room with going to sleep. When you do lay that baby down, it's important to lay that infant on their back to sleep. We have discovered through experience that babies are least prone to sudden infant death if we lay them in their bed flat on their back. That doesn't seem right when you think about it, but it's just the facts. So lay them down flat, and they can protect themselves if they spit up and so forth. If they're strong enough and old enough to roll off of their back, well, you can let them, but until they're old enough to do that, lay them down on their back and let them sleep that way. What about crib safety? First of all, part of the back to sleep thing is we don't want them to get their face into fluffy things. So fluffy blankets are out. Those nice thin baby blankets that are made specifically for the purpose are fine, but big fluffy blankets, fluffy toys, and so forth really aren't the safe thing to have with that child. No fluffy pillows either. You don't need a crib bumper. You don't need toys in there with the child, and while it's really neat to have for those first few days when the child is old enough to reach up toward the cord that the mobile is on, or the little hanging things that people hang over the cribs when they're old enough to reach for that, those really are a safety issue, and you're better off not having them in the crib. Make sure the mattress fits tightly. There shouldn't be room for more than a couple of fingers to go between the mattress and the edge of the crib. The slats should be close together. You shouldn't be able to put a pop can between any of the slats on the crib. The crib should be in good repair. All the joints should be tight. There shouldn't be any posts on the end of the crib that the child could get their clothing over and be suspended from those posts. And just recently, we've started to recommend that there not be drop sides on the crib either. The sides should be fixed in place. Feeding the baby. Well, obviously there's two main ways to do that, breastfeeding and bottle feeding. We certainly promote breastfeeding as the best way to feed the baby, but obviously that's not for everybody. There are many benefits to breastfeeding. The nutrition is best. It reduces the risk of infection, especially diarrhea-type infections during the first year. It's easier to digest than formula, and it's good for bonding. It gives you a chance to cuddle up to that baby several times a day. As far as getting started, check with your doctor about any medications you're on to make sure that they're all safe and appropriate. Be aware that it takes 5 to 7 days for you and the baby to learn your tasks. Babies start off with a lot of reflexes, but there's a lot of learning that has to take place from both mother and baby. And so don't get discouraged. It's going to take some time, and we have some very nice and well-trained ladies who are lactation consultants who will work with you not only when you're in the hospital, but will work with you after discharge to help make sure that the whole process gets going well. So bear with us as you and the baby get up to speed. As far as supplies goes, there really aren't a lot. Nursing bras are very helpful. You don't want things that have plastic in them that are occlusive, because you want that skin to have a chance to dry out. And bras that have the flaps so that you can easily expose things to feed the baby do make things more convenient. You'll need some nursing pads to absorb any extra milk flow. They make some plastic devices that are supposed to be the equivalent, but again, that holds moisture against the skin, and we try to avoid that. Having a breast pump available will help you get your milk supply up to speed, and if it works for you to have some milk in the fridge for the baby when you're out and about or at work, a breast pump is a very useful thing to have as well. Vitamins and iron. You need to make sure that your nutrition is good. One practical way to make sure that you're providing adequate vitamins and iron for yourself and the baby is to continue on your prenatal vitamins while you're breastfeeding. Bottle feeding. Bottle feeding is not for everyone, or breastfeeding is not for everyone, and it's nice that we have some very high quality, very carefully designed infant formulas available to serve as a substitute. Now, as far as the pros and cons, obviously it gives you more flexibility. and convenience. As far as supplies that you will need, bottles, a brush to clean those bottles, appropriate nipples, and there are a lot of different nipples out there, and babies have kind of a preference, but start with one, and if the baby just absolutely will not put up with that one, well, then you'll need to try a different one. But there's no magic way of knowing what your baby is going to like to begin with. You'll need a measuring cup as well. Now, when you go to the store, there are all kinds of formulas out there. The good news is that the formulas that are available on the shelf are really all nutritionally equivalent, so that you won't go wrong by picking one or the other. There are a few out there without iron, and I would recommend against those because the babies do need that iron. But otherwise, it's all about different proteins and so forth. And while the standard formulas like Enfamil and Similac have been out there a long time and are very, very good, there are many other formulas as well that do just as good a job. Some of them are listed as being for babies that have sensitive stomachs and so forth. And if that works for you, that's fine. But the nutrition in the end is really all the same. Spitting up. All babies spit up. It's part of the human condition. Some are spittier than others. If your baby is spitting up a lot, while it's a nuisance, as long as they're gaining weight appropriately, it really isn't a health issue of concern. What can you do to help keep spitting under control? Well, small frequent feedings help. Feed the baby until they're just acting like they're full, and then give them a break, and you can finish the feeding later on, particularly if you've given them the chance to be burped and get that bubble out before you finish the feeding. The second thing is to have their head higher than their bottom after the feeding, and you can do that just having them over your shoulder. I would advise using a burp cloth, or you can put them in their car seat with you being able to observe them, so that they have a chance for gravity to help you out. Solids. The grandparents are going to want you to start solids early on so that they can help feed that baby. But breast milk or formula are best until about 6 months of age. So it would be our preference that you wait until about 6 months of age to introduce solids. Start off with the things that are mostly carbohydrates and not a lot of protein, like the cereals, especially rice cereal, and the starchy vegetables, especially things like carrots and squash, and then advance to the other foods over the following 6 months. And it is actually possible to go the entire first year on formula or breast milk alone. But what's going to happen at around 6 months of age is the baby's going to look around and see that everybody else is getting stuff and they're not getting stuff, and they'll tell you when they're ready to have something off the spoon. As far as weaning goes, the best thing for the baby is to be on formula or breast milk up until the first birthday. They need that extra iron especially, and the other vitamins, especially vitamin D, so that they will grow and develop well. And they need that balanced protein intake as well. And while many parents choose to go to other foods during the course of that year, you can do the best thing nutritionally for your baby by sticking with breast milk or formula until the first birthday. Crying babies. Well, all babies cry, of course, and they cry pretty much the same for anything that they want, so it's frustrating to try and sort it out. They'll cry because they're hungry, because they're uncomfortable, because they're lonely, because they're bored. They'll cry because they're afraid. They'll cry because they're overtired or because they're overstimulated. And what's helpful is to have a routine that you go through to sort these things out. Just kind of have a mental checklist and go through the list the same way each time. that not only helps you figure out what's going on with the baby, but the baby gets comfort just from the fact that you're going through the routine, and they get comfort from going through the routine because they know that you're going to come up with an answer at some point. That routine is going to include checking the diaper, checking to see if there's any area of discomfort. Back in the days of diaper pins, you'd always check to see if a pin was sticking the baby, but binding elastic or something like that can be a problem. Check and see if they're too warm or too cold. Check and see if they're hungry, of course. Now, sometimes babies cry for a reason that you can discern. Sometimes they can't. Some babies are real criers, and while we can't tell you exactly what it is, we all know about it, and that's colic. This is something that happens at 3 weeks to 3 months of age in most children. It seems to be a developmental stage that they need to go through. 2-month-old babies spend more of their waking hours crying than they do at any other age, and then it gets better after that. So they just seem to need to do that. And it also seems to occur right about the time when you're ready to go to bed in the evening. So it's kind of an evening thing. How do you tell if it's something worrisome or colic? Well, that's not always an easy answer. The first thing is if they're following this kind of pattern, you can feel comfortable that it's colic. The other thing is that babies who have colic have a healthy, lusty, angry cry. These guys are torqued, and babies who are ill generally have a more feeble, more worried cry. They just aren't nearly as vigorous as those colic babies. Colic babies are vigorous. Now, what kinds of the kind of baby you have is part of the equation too. Some babies are mellow, and whatever happens in life, they're okay with it. And some babies are uptight, and they have to have things just so. And the babies that have to have things just so, just like adults that have to have things just so, tend to pitch a fit when they aren't quite what they expect. And that's just the nature of that baby. What kinds of things can you do to help? Well, you can, and these help for any kind of crying. Caress that baby. Keep moving, and that jostling, repetitive motion of walking around with the baby helps. Sing. A nice rhythmic melodic sound will help. Let them suck on something. Some babies love pacifiers, others really don't care for them, but for some babies a pacifier can be a real lifesaver for both the baby and for you. Some gentle pressure, warm pressure on the stomach will help, and you can usually do that just by throwing them over your shoulder and cuddling them up nice and close. The thing that incorporates all of the things that work reliably for colic is something you're familiar with, and that's sitting in a rocking chair, so you're rocking the baby back and forth. Hold them up close to you and snuggle them up and sing them a song. And those things work well. Now, in the summertime, another thing that we like to do with ours was to go down to the Dairy Queen, because putting the child in the car and the rumble of the engine and the gentle motion of going down the road and listening to the radio would put those kids out. So that's a very effective tool as well. Well, when should you contact the doctor? That's always a tough question. Probably the best indicator of a problem is poor feeding. The most complicated and demanding things that babies do is to eat. So if the baby is feeding poorly 2 feedings in a row, particularly if it's accompanied by listless, disinterested behavior, that's worrisome. Stiff neck or irritability when handled. Babies who aren't feeling well but are basically okay, like to be cuddled up. Babies who would rather be left alone than picked up and cuddled are worrisome. If your baby seems to feel worse when you pick them up and hold them, that's a reason to call the doctor. Also, if the lips or the face have a bluish or grayish cast to them, that's worrisome, and fever. Now, fever is a tough one. I can't give you an absolute number on fever. There isn't a good one. I think the best approach is to put your lips to the baby's forehead, and if the baby feels warm, then that's and the baby's ill, that's a reason to contact the doctor or the nurse and see what's going on. It's okay to go ahead and use the thermometer to get a number as part of the discussion you have with the doctor, but if the baby feels warm to you, that's a fever, and the number really doesn't matter very much. All right, well, I think I've come to the end of my prepared remarks here.
Well, thank you, Dr. Allen. To remind our listeners, the questions can be submitted from the box in the upper right-hand corner of your screen. And again, if you can't see the screen, click on the little orange box with the white arrow, and you can type your questions in, and Dr. Allen will answer them. Okay, going to our first question. Dr. Allen, how do you swaddle a baby, and why is that a good thing to do?
The swaddling a baby involves simply wrapping them up tightly in their blanket. And the reason this works, we think, is that babies are used to being all tightly folded up with gentle pressure all over them when they're in the womb, and folding them up and putting them tightly in a blanket gives the feeling of being nice and safe in the womb again, and it really does help them calm down. It's an effective approach for colic as well. This is one of those things that practice makes perfect. Put one side of the blanket over the baby, and then the tail that's down by their feet on top of that, and then take the other side of the blanket and put around the baby, and just wrap as snugly as you're comfortable with. You really can't get it tight enough to harm the baby, but if it looks comfortably snug to you, the baby will feel that and derive comfort from that.
Sounds great. Another question we have for you: when can my baby be vaccinated against whooping cough? We're hearing a lot about this on the news right now, and have an answer to this question.
The immunizations that your child gets for whooping cough are at 2 months, 4 months, and 6 months. The immunity that the child gets from the shot really isn't appreciable until that second one at 4 months of age. Unfortunately, the real age for risk of complications from whooping cough is the first 6 months of age. So by the time the shots that we give directly to the child work, the baby's pretty much past their risk factor. So when you come through the hospital to have that newborn baby, we will talk to you about immunizing other members of the family, particularly the parents, because if the parents don't get whooping cough because they've been immunized, that's the best protection we can give to that newborn baby.
You mentioned the hepatitis vaccine, but I've read online that that can be bad for babies. What is your opinion on that?
Well, there's a lot of stuff out there on the internet. As we talk to our expert pediatricians about immunizations, the fact is that the hepatitis immunization is one of our safest immunizations. And as our children grow older, they're exposed to blood products and other sources of being exposed to hepatitis. And our expert's advice, and I subscribe to it, is that the best approach is to get as many people as we can immune to hepatitis B so that we can keep it from spreading through the community more than it has already.
Dr. Allen, do you encourage co-sleeping?
Well, no, not that it isn't great to cuddle up with that baby on the couch, but unfortunately, co-sleeping is associated with sudden infant death, and it isn't entirely clear why that is. But as a safety issue, the baby should be in their own space, sleeping flat on their back, and not have objects around that they can get their face into and obstruct their breathing.
Here's a question. If you have dogs, is it all right for the dogs to sniff and look around the area where they're young?
Well, I'm not a big fan of having pets around babies. I know people do and so forth, but pets are not very clean things. And when you think about what dogs get into when they're outside sniffing around, and you don't want them bringing that into the baby area. So the answer is that to the extent possible, pets should be kept out of the areas that are the baby areas until the child is old enough that they can fight off whatever the dog or cat or hamster or iguana brings into their area.
Mostly you're talking about dogs. Any other special concerns with cats in particular?
Well, cats, particularly young cats, tend to have problems with toxoplasmosis, and if the baby gets exposed to toxoplasmosis actually in the womb, it can be a devastating disease. But cats bring other things in. Where I've seen actually the most problems, believe it or not, are from reptiles giving the baby salmonella. So I really have issues with people handling the turtle or the lizard or the iguana and then handling the baby. It's a problem.
When do you recommend beginning tummy time, and how long do you recommend spending time on the tummy?
Well, babies learn about the world by exploring things, and certainly as soon as that umbilical stump is off, they can be on their tummy, because that's going to help them build their shoulders and give them a different perspective on the world. Basically, as they grow older, as long as they're able to get their head up off the mat, they can be on their tummy, and when they're tired and they're just laying their head down, then that would be time to flip them over. All babies can be on their tummy as long as they're being observed, and once they're old enough to flip themselves over from front to back and back to front, which is 4 to 6 months of age, then they'll do tummy time for themselves. But up until then, put the baby on their tummy when you think of it, and as long as they're having fun, let them do it, and when they're tired, put them back on their back.
Very good. You also mentioned vitamin K in your presentation. Doesn't that increase the risk of newborn bleeding problems? Well,
there seems to be some issues about giving the baby vitamin K shots out there on the internet as well. But some babies are born with not enough vitamin K in their system. And while it's rare, the consequences can be devastating. And by that I mean strokes. Especially if the mother is breastfeeding, it's possible for the vitamin K levels to be low, and we have learned from experience that if we give this quite safe shot to all babies, that we can reduce this risk of uncontrolled bleeding to a minimum.
We also have a question just come in. I've heard you should give babies vitamin D drops when breastfeeding. Do you recommend this?
Well, we have recently had an increase in interest in this area by the experts, and the feeling of the experts right now is that even though breast milk has vitamin D in it, that it isn't possible to give the optimal amount to the baby, even if the mother's vitamin D levels and intake are adequate. So the recommendation of the experts would be to go ahead and give supplemental vitamin D drops. Is it a terrible thing if you don't do that? Well, no. But if we're going with the recommendations of the experts, it would be yes, go ahead and give some supplemental vitamin D.
A tape of this program will be available at www.mercycare.org/live within a day or so. You can always check this website for information about future webinars, as well as to listen to any of our past webinars. Our next webinar topic is entitled, Could It Be ADHD? With Dr. Mary Einson and Darcy Kane, ARNP. Their webinar will be Thursday, September 13th from noon to 1, and they will take your questions live after the discussion also. I believe we have covered all the questions that have been submitted to us, but if you have additional questions or concerns, Dr. Allen can be reached at 319-398-6350. Well, thank you all for joining us today.